What is the difference between a CORT scan and X-ray for pets? Imagine trying to see inside a pet's body like a detective solving a mystery. You need the right tools to find clues about what's going on. That's where veterinary radiology comes in, especially with two main imaging options: X-ray and computed tomography or CORT scan. Both use X-ray technology, but they do it in very different ways. An X-ray is like taking a quick snapshot of your pet's body. It uses a small amount of ionizing radiation to produce flat, two-dimensional images. These images are great for seeing bones clearly, like broken limbs or fractures. They also help find bladder stones, swallowed objects, some tumors, and check if a pregnant pet is expecting. But X-rays have their limits. They don't show soft tissues like muscles, ligaments, or organs in much detail. You get a general idea, but not the full picture. A CORT scan, or computed tomography scan, takes things a step further. It also uses ionizing radiation, but instead of one flat image, it captures many X-ray images from different angles around your pet's body. A computer then combines these images to create detailed cross-sectional slices. These slices can be viewed in 3 dimensions, giving veterinarians a clear look at both bones and soft tissues. This makes CORT scans perfect for diagnosing complex issues like nasal diseases, lung problems, ear infections, blood vessel abnormalities, and even bone tumors or fractures that are hard to see with a simple X-ray. Both procedures are safe and non-invasive, but they do requiring your pet to stay very still. Often, sedation is used to keep them calm and still during the scan. X-rays are usually quicker and less expensive, often taking just a few minutes. They are commonly used as the first step in diagnosis because they are accessible and fast. CORT scans take longer, sometimes up to 30 minutes, and are more costly, but they provide a much more detailed view that can be essential for planning surgery or treatment. In terms of cost, an X-ray can range from $50 to $200 depending on the area and number of images needed. A CORT scan can cost between $500 and $1,000 or more, depending on the complexity and the facility. The choice between the two depends on what your veterinarian needs to see. If a simple fracture or foreign object is suspected, an X-ray might be enough. But for detailed soft tissue evaluation or complex conditions, a CORT scan is often the better choice. In summary, X-rays give quick, flat images mainly of bones and some organs, perfect for initial assessments. CORT scans produce detailed, 3-dimensional images of both bones and soft tissues, ideal for complex or hard-to-see conditions. Your veterinarian will decide which imaging method best suits your pet's health needs based on the symptoms and what they need to find out.